a few terms, HRCT, high resolution CT. What does it actually mean?
It's just an algorithm. We have different filters in our scanners that make the images look soft or sharp, but sharp with good resolution. So high resolution CT started in the earlier days because you actually had to improve the resolution using computer techniques. Today all machines have it standard, and so even whether you say HRCT or not, if it is for interstitial lung disease, the center will give you those images.
So if the family physician is thinking of interstitial lung disease as a possible diagnosis, should he write specifically HRCT?
It's fine. You can say CT for interstitial lung disease, they'll understand as well.
And what is low dose CT?
So that is a specific term that we use in smokers, where LDCT or low dose CT started about 10 or 15 years ago, where people said that screening for lung cancer in smokers will detect nodules and cancers earlier and apparently save lives. And to make, basically when the trials went to ethics committees, the ethics committees will say, but you're doing CT scan and you'll give so much radiation. What about additional cancer created by the radiation? Because you're doing a preventive scan. It's not a scan done in a symptomatic patient where you can argue and say radiation is completely harmless. You're taking a normal person and saying, now I'm going to subject you to a test. You at least need to justify all of this. So, and ethics committees also have a lot of lay people within them. So to do that, they brought down the dose by almost 90%. And showed that even with that low dose, you can still pick up lung nodules well. In fact, it became so good that we now use a low dose for everything. And we still call it low dose for smokers because it's become a term. But the same dose is now used for everybody. It's just the technology has become so good that every year a new machine will mean slightly lower dose of radiation to a patient.
So for low dose CT, our usual recommendation is a person probably doing 20 years of smoking 20 cigarettes per year, which is called 20 pack years. Such a person should undergo a low dose CT. Annually, you would say, is the recommendation?
So we have to understand the difference between payments in India and in the US and the UK, right? In the US, all guidelines are based on somebody paying for it. They come out with guidelines because somebody has to, pay, and there is a cost and things like that. So when the USPSTF, that is the United States Preventive Task Force, or somebody comes out with a guideline and says that if you are 20 pack years, which means one packet of 20 cigarettes a day for 20 years or something like that, then your low dose CT will be reimbursed by insurance or by the government for free, right? Or when they say that you should get a screening mammogram done for breast cancer every year, that means in the US, whoever your insurer is, and even if you're not insured, the government will pay for free for that mammogram. Or in the UK, because the UK doesn't have that kind of money, they reimburse once in 2 years. So you can walk into any NHS hospital and get a free mammogram done once in 2 years. If you go every year, then you have to pay out of your pocket, which they are not used to paying out of pocket for any. Those of you who have relatives in the UK and US know that they will wait for a month, but they will not pay out of pocket. And it's not like here where you can get everything done in 1 day from diagnosis to surgery. There, everything takes 1 month, 2 months, 3 months, and things like that. So the 20 years criterion is for reimbursement, 20 pack years. But now you tell me somebody who smokes 1 packet of cigarettes a day for 19 years, that is 19 pack years, is the risk of lung cancer lower than somebody who's smoking 20 cigarettes a day for 20 years? It's not, no? I mean, 19 and a half, 20. But if you're 19 pack years in the US, you don't get a free LDCT because they will not reimburse. It's guidelines, no? Eventually, the cutoffs mean something. So, in our country, where there are no guidelines for anything, pretty much, we even do 10 pack years, 5 pack years, because any smoking has a risk. It's just that the risk benefit ratio to somebody who's paying is more when you only take people who have 20 pack years rather than people who have 10 pack years. But in our setup, anybody who's a smoker who walks in, we will do an LDCT. And we have some pulmonary physicians who ask all smokers to get it done, simply because, you know, it also, if you find something, then it helps that smoker quit also. So there's a psychology or behind making them do it as well. So.
And the other reason why pulmonary cancer screening has come about is because the treatment has changed remarkably in the recent years. So something that was completely incurable a decade or two ago has become very curable. So it is important that we do. This is a good message that even 10 pack years might be qualifying for LDCT. You don't need more.